Hello everyone, I am Dr. Ranjitha, practicing at Viva Skin Tech, Yelahanka, Bangalore. Today we shall discuss about Herpes Zoster, also known as shingles. Welcome to DermaVidya's Herpes Zoster edition. Here in DermaVidya, we are making attempt to educate you people to early diagnosis and identification of herpes. Because many a times herpes starts differently, which will misguide you to wrong diagnosis. So here we'll help you identify earlier signs. Herpes zoster is a condition which is associated with pain and water-filled blisters on the skin. Usually, herpes zoster starts initially as a pain and burning sensation on the skin. During this phase, patients get misled to different things. Like if it is placed on limbs, people think it could have some muscle pain or bone pain. When the lesions are present on the chest, people will get misdiagnosed to cardiac conditions. So before the lesion starts, before the water-filled blister starts on skin, patient will experience pain. The pain could be localized or radiating. So when patients experience pain, which is pain associated with burning sensation and radiating many a times initially, after a couple of days, people will start seeing redness and small clustered water-filled blisters, something like chickenpox, because herpes is nothing but reactivation of chickenpox, which happens in elderly patients. But unlike chickenpox, this will not be spread all over the body completely. It will be localized in small particular area. So it will be usually present only on one side of the body, not on both sides. So how is this pain during herpes zoster? It could be burning sensation or pricking sensation or tingling sensation. Sometimes the pain could be severe. It's subjective from patient to patient. The lesions, when it starts, you should now know that it's not just a pain related to any other condition but herpes. So you need to visit your dermatologist earliest possible, because the treatment or antivirals for herpes need to be started within 48 hours to prevent later complications. Herpes is mostly a clinical diagnosis which can be done perfectly when you visit your dermatologist at the right time. There is no any clinical lab diagnosis necessary for herpes zoster. So the treatment for herpes virus includes a set of antiviral drugs with painkillers, symptomatic relief, and local antibiotic creams, which will be prescribed by your doctors to prevent any further secondary infection and progression of the complications. So if you don't treat herpes on time, what are all the complications you can ideally see? Mostly in younger patients and when the lesions are on the trunk, the complications wouldn't be that severe. Just people could go for postherpetic neuralgia, which can last for 1 month to up to 1 year in certain cases. So to prevent that postherpetic neuralgia, you should get it treated as early as possible. While herpes happens in older patients, especially when herpes is on the around the eyes or on the face, which can lead to cerebral complications of meningitis and other things. In elderly patients, we need to treat herpes very aggressively, especially when the lesions are present on the face or around the eyes, to prevent any meningeal complications. So it's important for patients to remember that during the painful phase, even before the lesion starts, kindly refrain from using any chemical based home remedies like painkiller sprays or hot fomentations or salt fomentations, anything which would aggravate the condition. Most commonly asked questions for me when I say herpes is a reactivation of chickenpox is, do we need to isolate? Ideally, isolation for herpes is not necessary, but in a rare phenomena, we have seen when kids around in the house could catch up chickenpox. It's a rare phenomenon, we have seen cases. So it's advised that you could isolate at least from younger small kids at home. Just like chickenpox, today we have vaccines even for herpes zoster. So kindly consult your nearest dermatologist and get the elderly person in your family vaccinated for herpes to prevent any further complications. Also follow DermaVidya for any further educative videos about your skin and hair issues.
For more such videos, visit or log into dermavidya.com.